one is called the tonic labyrinthine reflex, also referred to as TLR. This is something, again, that's present in utero, and it will be inhibited or dampened by age 4 months. This is something that's seen that this baby develops in relation to gravity. The other thing that it's helpful for is it's helpful for exiting the vaginal canal. So we can have that head go into extension and allows those arms to come back as well. When this is still retained or present in a kid, this is typically a kid that will have issues, again, with balance and coordination, but this kid also may, one of the main things you're gonna see is that this kid has issues with car sickness. They don't do well with motion. They don't have the ability to sequence like other children, and their timing is also off. So this is definitely something that wants to be, or that needs to be addressed as well. This should definitely be integrated by 4 months. So if this is still present in a 5 or 6-year-old, then you're gonna be seeing some of these issues. This is, again, not an easy or not a hard thing to test. It's pretty easy. What you're gonna do is you're gonna have the kid stand, feet together, hands by their side. You're gonna ask them to close their eyes, and then their goal after that is that they are just supposed to tuck their chin to their chest and look all the way up to the ceiling. And we're gonna do that 5 times. What we're looking for when they're doing this is we're looking, are they able to go all the way down and all the way up? Do they have good range of motion? When they go to do it, are you seeing excessive motion or movement in the body? So if they're going to do this chin tuck or chin extension, and then they are kind of moving all around, or they're falling forward, or having excessive movement, then we know, okay, we are having an issue here. This is absolutely testing positive. You may also see where they go to do it. So an example would be they go to flex their head forward, okay? And they step or fall a little bit, okay? Or they wobble around, okay? That right there would be a positive as well. They go back, and we see the same thing. They lose their balance. You have a little side step or something, whatever it may be. Any excessive motion is a positive in this area. Another thing that we may see with a kid that has a positive TLR would be a stooped posture, okay? So this rounded back here. And again, this is due to potentially having a retained primitive reflex. Could this be absolutely from poor postural tone from electronics? Absolutely. So if you want to rule out whether or not it's from poor ergonomics or whether it's from a retained primitive reflex, this is a really great test that we can do to do what's called a differential diagnosis. So how do we rule out which one so we can get us closer to the potential reason or contributing factor to what our issue is?